Okay, on a kusha on a cabo, my name Natimu John Fuller, and the Salon Organization of Greater Manchester, and I bring on this program when I Bɔdi, Bεttεh pass Gentri. This is session 17. You know, Italic say we don't all self the program, but yes, session 17, and today we'll talk about prostate cancer, and Dr. Mohammed Toure now going to present to you today. So I will just run through the team quick, then also let you know how the session will be done. Then I will hand on over to Dr. Toure. We will take on through the whole session. Like what I say before, while the program they go on, while the presenter they present, we go mute everybody. That now for allow the presenter able gain message uninterrupted. When he finish, when I will get time for ask as many questions as possible. And as soon as I will see why they go through the team we get now, and I will see we get a wide knowledge of people, then people that they work in different sectors. We go try for answer on a question. However, if we able to answer on a question on the show, we will take on a question away and get in touch with you personally. And if now something we're not too personal to you, you know, we go identify you, we will put them out in public as well so other people then will benefit. Okay. So I'll go through the team quick, then we will begin. Okay. Like they say, it's an organization of Greater Manchester. Now we start this program earlier this year. This program now for we bring medical information to we people them in we own language, Krio. When they say people don't understand English, then they understand. But sometimes the way we can sit down before with man, so man not able to ask question. Also, sometimes the thing they wouldn't tell we half of them will not understand. But then program of the brand can follow we explain them to people them in we own terms, break them down, make them small, so people can be able to understand properly within the medical condition them be. Sometimes they suffer from the NTR, but waiting can happen is if you don't hear it from this show, you will make say in future you don't be informed that if something for happen to you, you know waiting for do, when for call the doctor or when for just go to a pharmacy and try for sort your problem out. Now please do me family and the advice for the Guinea not to a certain individual we point them out to. And also we know they have for replace on medical professionals them on a GP or consultant. We only deny or give on advice. You know, like general advice with the give. So dear, when I continue for listening to our doctors them and our medical professionals. Okay. Okay. Not to me one in the team, so I will begin to introduce the team. The first person we get now Dr. Mohammed Kamara, we most of us Sabi. I am Doc. Doc is specialized in emergency medicine, and I also now we Agbagba at the group. Now the Alagba 90 at the top. Okay. In every way they do, you need somebody for be the group lead, somebody for lead. Okay. So Dr. Kamara 90 lead. Okay. And also in the group we get Miss Gugia to Kamara, when a mental health nurse and also a health visitor. Okay, so anything around mental health and stuff like that, you will help, and also anything for do with picking business, you know, like how for being up picking and any question who person gets, go answer. Okay. And also that the team we get Mr. Ibrahim Sise when a qualified social worker and also a mental health advocate. And you know, say within the social work sector, it's like we see them call social worker, people are not begin to say, oh, now they look at in a bad thing they happen. Mr. Kamara go there so for able to explain things, you know, how the social work sector they work, you know, you able to break things down for what we understand. Instead of with afraid, if you know the information, you not go afraid, you go know what thing for do. Okay. Next person we will get Miss Fatima Kuroma. I'm not sure if you could join me today, but he said we don't present to we in the past. He specialized in black people and kind of food. You know, normally we don't give nutrition advice. And with my side, no more we can get, you know, we not get people that we specialize for give you advice in we own kind of food then we will eat. Well, Fatima and our own specialty then they able to tell you you know how what kind of food then for eat, which food they way healthy, you know, how you able to eat a balanced diet. Okay. And next on the list, we get Miss Aminata Jallo. I'm not sure if go join me today, but if you don't present to we in the past or something, they can then at the panel. Now, a clinical pharmacist, and I get the sabi for how you for take medicine, how you for look after medicine, which kind of medicine then for take, you know, all in kind of thing then they where you can day on, it will give you advice. Now, if you get question that on that topic, not say because you know that you know go ask the question, we will try to pass the question over to them, they will answer them, and the next day will be online. We will give the answer, or we will provide you with your email later, so you will able email we any question we get, we will try to answer you. And if that's something personal, we promise you say we not go make you detail public. we will keep them private. As you know, all the people are medical professionals. They will treat you just like how they treat their own patients. Okay. Next person on the list now, Dr. Mohammed Toure, we're a general practitioner. And also, I don't know if you want to say this, but now person with a bone as well. I believe they get other specialties as well, and I only present to it today. So now we get to see in Facebook. And the man we, so far in picture don't elude we, we not don't see him before, but yes, I only present to it today. So I hope say on prepare all the question them. It is ready for now. Okay. Next person is Miss Aisata Shaka, in a mental health nurse and social worker, and Miss Shaka in specialty in mental health. So himself, like how we get Miss Rugia to and other people at the team, himself go able to help you with any mental health question we get, but also you get experience in other areas as well in the medical field. Okay, next we get Miss Fatmata Kamara with Mrs. Doc. I obviously allow for say that. Yeah, now Dr. Kamara in Weth, himself a mental health nurse. In no good day with today, but maybe he might join me later on, at the moment. Okay. All right, and last but not the least, now myself will talk to now, like I'll be saying, I'm in Timu John Fuller, I'm a business IT consultant. Me role na this program, one, as now the host, I make sure say, I talk to and stuff, but two, I me they work in the background with every member on the team for make sure say this program can to now without any glitches. And that is my role. So now, without further ado, I can pass on over to Dr. Kamar and Dr. Toure. Like I said before, if you want to ask you any question, at the email, this one I can send them. So now you can pass now to Dr. Toure. Dr. Toure, we can take on through prostate cancer. We're at the topic today. Dr. Toure, when you're ready, please, sir.
Okay, thank you. Because now topic where we know say a very much a useful topic now in community, and we think that this topic here it will be useful to everybody with the area. Okay, so I will share my screen and then we start the discussion. So as Mr. Fuller done make an introduction, my name Dr. Toure. Apart from general practice, I don't do orthopedics for a while, and a specialist in that direction as well. And so today we talk about prostate cancer. We move on. So waiting we get for talk about today. Now just overview highlight here. We will talk about first waiting at the prostate. Waiting at we say a day and waiting it they do. Then we talk about to a main topic when a prostate cancer, and then the things that we people then they watch for, what they call the signs and symptoms. The way if you notice anything in there, you get anything in there, before begin to think, say for see you doctor. And as Mr. Fuller say, yeah, this is not just an awareness. We try for raise up to people them for know when for see the doctors them, and if you go see your doctor, within really you're supposed to say to your doctor. We not they replace any of your doctor here. So we give an overview of how then they go about for the doctor they go about for diagnose, say you don't get cancer, prostate cancer, and what type of treatment then they. So because if you're aware of them treatments that were available and you know it in a prostate cancer, it will help you a lot and it will give you the confidence for know what you go say to your doctor. And then we will talk in the end, what do you do, how is it when you live with prostate cancer in general? So we start with here, this picture they show within the prostate. The prostate itself, if you can able to see my mouse, naya acidum, they just under the bladder. The bladder, now that part of the human body where all the water, where with the where the bad things the way the body they don't produce, the water they can't see them. Now this bladder, yeah. And from the bladder you get a small pipe where they come out down. They go through. If you follow my mouse, till it go out, right? And this the prostate gland we call them. It just stays underneath that bladder there, okay? And in close to ram, you get another gland where when the sperm don't make we say it can store. So in they actually between them two organ in there. And based on how the prostate is, it affect then organ the way surround them. Okay. Now the prostate cancer and the prostate itself, how they can give as an analogy, say it look like the walnut. If you can see here, this is not the walnut. Now so it's small, but as person they grow, as a man they grow, they increase in size, like a ping pong ball, you know, to this orange ball you can see. Then as they grow older, over the age of 65 or so, they become even bigger, like the size of a tennis ball. Okay, now this is not the prostate gland itself and the bladder. The prostate, they in layers. Like anybody, it is well close. You get close with cover them, what they call the capsule. But inside, again, the prostate, it get into different layer. You get the outer zone, you get the middle zone, and the inner zone. Now, waiting at the importance of this layering. And the importance of this layering is that when somebody they get prostate cancer, it starts from the outer side and not it starts inside. It starts from the outer side. So somebody will get prostate cancer, it will get them for years, for decades. You know, they even know if you get prostate cancer because you get no symptom at all. Unlike the other condition they call benign prostatic hypertrophy, when the prostate is just big, it starts from inside. And when it starts inside, it quickly press on the pipe, the water pipe. So somebody then the person they easily start to get problem where they go wee. If they get problem, either the wee they come out and come off properly, or it is stop and start. So it is start for easily get symptom, and then kind of people and they easily, because of them symptoms and the way they get problem for pass water, they go see doctor easily. But that condition they normally not to cancer itself. Now the gland just big, like it don't big like a tennis ball. Unlike the cancer, in the outside, it no they cause any problem at all. Okay, so again, we talk about the prostate cancer. This is just a picture of the prostate cancer, the prostate gland, and also the tubes that we surround them. And now the conditions that we can happen in when somebody they get prostate. The prostate gland itself, what it do? It produce the fluid or the water where they mix with the sperm for let it go and go meet forget for let and picking go come. So that na mainly na in role. And one of the chemical we they produce, then they call them PSA, prostatic specific antigen. We'll talk more about that in due course. So in this prostate, several things can happen with them. One, it can be infection. So when you get infection, then they call prostatitis. Okay. And the other thing we can happen to them, it can big, like I don't mention, you know, like a tennis ball, it can big. So this not to cancer at all. This not to cancer. We will get a program where we will talk about that in detail, and then to then in detail. The prostatitis not just an infection or inflammation. We're not to cancer at all. And the prostatic hypertrophy in just a big instead not to cancer. Now, the thing we'll discuss now in our topic today, now the prostate cancer itself. Now, just to give an overview of what's in prostate cancer, according to studies done in the UK, we know say 26% of all cancers really happen within man them na prostate cancer. In fact, now the second most common cancer where it occur per man them, apart from lung cancer, with studies shown in the UK. About 11,000 people and they die, you know, every year just as a result of prostate cancer. And because of the awareness, you know, then so much awareness now, people they go meet their doctor then and ask them about prostate cancer, and they do them tests, so they're able to diagnose most people now. So I mean, every year it's like 48,500 people then can diagnose of cancer in the UK. Now this cancer, prostate cancer, very much common, between people of the age from 65 to 75. Now, this no means say if they're outside this range, you know, they person they get cancer, prostate cancer, they still get them. 25% of them people in the under the age of 65, so it can be 40, 50, it can still get the cancer. Right? But as I said earlier on, it may not get any symptom at all, until it don't spread. It don't go to a stage where very little they can do something at the time they didn't get any symptoms. So which is why they make them program there for let people aware that this thing can happen. So if you know about this or you're in this program, you can meet any doctor so that it will start at least, then they check them and make sure say it's fine. Okay. And studies don't also show say prostate cancer is very, very much common among Black people. Okay. 1 out of 4 Black men get the tendency of getting prostate cancer. And if you compare to the Caucasian, you know, 1 out of 8 of them, now they get them. But you see, most of them, now they can worry about this prostate cancer and they can go meet doctors they even, you know, so they come for just simple other thing, you know, back pain no more. If you dig into it, I would say, really, I'm concerned about prostate cancer. Then the doctor they go into it. But you will see very less number of people in the Black community, they go and they even think about that, or they even see doctors. Okay, so the good news about all of this is that prostate cancer, if the diagnosis are early, is curable, and somebody can live a life as long as possible if they diagnose are early and they take the proper measures, which is why we did do them program there. Now, waiting at the cause of prostate cancer, we so far with all the studies, they're not really able to find out the main cause of prostate cancer. The cause is unknown. Nobody know the cause. However, we know say there are things there where we call, if you expose students in the chance of you getting cancer is very high. So the first risk of getting prostate cancer now you being a Black man. Now the first risk than they. And for a Caucasian, if you take the age group over the age of 50, now it begin develop, then they say the risk of and begin they come high. But for a Black man at the age of 45, the risk is even high. So if you're a Black man, 45 and above, whenever you go see a doctor, I guess for they think about anything and they, so that the doctor will at least check, basically. And also the other thing where they don't find out, say, can expose people into prostate cancer. Now, people who then get certain genes in them. Now, most common gene where they don't study, now a gene called BRCA gene. You get different types of them. Now, this BRCA gene, this now basically just in a simple form. Now, the thing where they control, sometimes they control the way the organs then at your body they work. But certain organs then where they more affect. If you get BRCA gene, the chance for that person get breast cancer is very high, and the chance for they get cancer of the ovary for a woman, then we know the ovary and the organ where they pull the eggs for let it get picking. The chance for get that cancer is high if then they didn't own a family, and the chance for get prostate cancer very high as well. The chance for get pancreas cancer is high, and also certain cancer of the muscles as well, what they call sarcoma, is very high if you not get this gene on a family. Okay? And other thing where they don't find out is somebody with overweight. You know, just they put on weight, the belly just the big, your body just the big no more. The chance if somebody will get cancer, 2 people and get prostate cancer, one you know get big body, the other and get big body. They all get big body. The chance for let your cancer spread faster is higher than they all will not get big body. So being overweight, they increase your chance by even 20%. You know, for let die of cancer. And for say every chance time we increase your weight, you know, we normally, when we check people and weight, they go, they call BMI. Now the way they check your weight and your height and see which side you fall. Each time you increase that, the chance of you getting the risk of cancer, they become higher. So in a nutshell, the best advice is if you know, say you're the put on weight, you try as much as you can for do exercise, stay physically fit and eat healthy and balanced diet. That's not the key thing. Okay, so what are the symptoms that people will experience when they get prostate cancer? Now, anybody where it begin get symptoms of back pain, it doesn't get back pain, it then get bone pain, and most people when they get them pain and then they find something for put on to na the work or na the old age or na the days. If you get back pain, in as much as you go meet your doctor for back pain, for give you medication for back pain, if you emphasize to your doctor, say you're concerned about prostate cancer as well. Some doctors then will go dig into deeply and for no, but some if they run out of time, we count back pain, we take out and you go just try for deal with and go. But if you, the patient, where they come meet and tell and say, doctor, I know I get this back pain, but really what they concern me here is now prostate cancer. Some patients don't say, I don't hear one program where they talk so you get back pain and a sign of prostate cancer. Then they come boldly. Then the doctor, they go deep into it now, they begin look and try for investigate. The other sign where people in the get or the symptom in the get are when they feel tired. Just tired no more, all the time they feel tired, they do much work, but just they feel tired, then another sign. The other one, again, problem with maintaining what we call erection for your man side tin up. Then a big symptom, not a diagnosis by say, now a symptom, just for your man side no tin up, can not only be a symptom for prostate cancer, it can only be a symptom for also somebody will get even high blood pressure or somebody where the circulation of your system, they work properly. So that's a symptom where you not for feel ashamed, say, they happen, it's not your fault. You for go see your doctor, let investigate, and there are different layers into just this erectile dysfunction, we'll call them. Even anxiety, things that happen around you with all the COVID and all the worries, family problems can make somebody, a man signing it up. So that no means say you don't get cancer, that no means say na your fault, but it's fine for go check. The other thing which can happen if you're in the wet and you notice blood na you wee. If you notice blood na you wee, then a big sign of say something seriously happened. But now for caution in this, it depends on the age. If you're less than the age of 40 years, you get blood in a wee, it may not be anything. Sometimes you need to get like 10 of them before sometimes the doctors begin to worry. If you did under the age of 40. But after the age of 40, you get blood na you wee. You need for check. Among the things then, prostate cancer are one of them. It can be an infection. Yeah, it can be say na other thing basically they happen with you. It can be say na the bladder itself get problem, but you need for let go. And then the most common thing with all forms of cancer, not just prostate cancer, if you see somebody begin to lose weight, if they eat properly, if they exercise properly, they do everything properly. He eats in to for say they get the food, they get the food they eat, but still they lose weight. You get for kind of a warning sign for say, look, I need for say me doctor, something else they happen. Apart from prostate cancer, almost most 90% of cancers, the sign with people in the beginning are lost when they lost weight or they lost their appetite. And the other thing we can happen again, what we call lower urinary tract symptoms, which in short we can say just load symptoms. Basically, person way they run for go wet, all the time they grab na net for go wet, and so until we go for go wet, the wet all need they come properly. You go tin up the tea, so until we done, you get for weight back for le afa for fan the left, and so then even the soil in pant. Sunday it can one go in the feast and they will empty bladder properly. Now, this symptom, in as much as a symptom of prostate cancer, is more common with somebody with prostate gland just big. When we get for talk about that in another program where a prostate gland just big. Say it can be in most cases, it can be saying that they happen not to cancer. So if you get any symptoms in there again, you go meet your doctor. Now, when you meet your doctor, the way the doctor go go find out, say, this is me say now, something a cancer don't they happen here. When they examine you, we don't tell the doctor, say, they get this, all them symptoms I don't mention. So, and the doctor says, well, let me examine you now. I they examine you, it try to feel the prostate itself. It could be an uncomfortable examination, but when it do, if it feel the prostate gland and you notice say it had like rock or like stone, normally like I say the prostate gland, it get close, like wall close over them. So when they pass your finger over them, they close, they glide through. But if you notice it, then they know they happen. But it look hard like stone. It begin to worry now. So something else they happen there. This it look like so we'll go further and check. And the other thing within the check again, now for check the one of the chemical where the gland they produce, then call them prostatic specific antigen. And just ignore the medical name, or a chemical with the gland they produce. And when that chemical they high in a system, then a sign. Now we'll talk about this chemical in more detail in the next few slides. So as I say, how they diagnose her now. First, now for let the doctor do the examination. It try to feel the gland as I explained before. And the other thing, now for do this test here. This test now a blood test they can do. And this blood test a very non-specific, because this chemical with the gland they produce, they produce even the normal gland they produce them. And the cancer, when the gland don't get cancer back, they produce them. So it's not very reliable. So now make get a cancer screening program, because if at all they do a cancer screening program, now this test for the use for screen, but it's not reliable. Certain things then they make it come up. Things like exercise. If like somebody do like the cycling, you sit on a bicycle, you can move it irritates the prostate, it can produce this chemical. So if then go do test, it go can high and maybe go create worry, go feel I don't get cancer always until not to him. Now because of that, the exercise we don't do. And also if somebody just don't get mama and daddy business, and up to 2 days after that, if they do that test, they high. Okay, and somebody will get water infection. If they get water infection and give you treatment for water infection, up to 4 weeks after that, it is high. If somebody go do now hospital and go test them, then go check and take some sample from that gland, up to 6 weeks it is high. So it's not very reliable. So like waiting, we can normally tell patients them, say this test they do is not reliable. However, for making as reliable as possible, things then the way you need for do before you do the test. All things I don't mention. 2 days before, for do any high exercise, if they say we can't do the test, so test, they can't do on Monday. So 2 days before Monday, no do any mama and daddy business, no do exercise too much, and the doctor can test your water and see if you get infection there. If you get infection, it will postpone the test. Just so for make them as reliable as possible. And this test I get for be useful if somebody they don't diagnose on cancer, then we get for repeat them. So if they don't do and want to, and you find out say, oh, this was a high, and it won't create panic and worry upon the person, and they repeat them. If you repeat it again, you don't do all anything in the normal, they will say, oh, maybe not something witty we don't do before I make it high. But if it's still high, then a sign say, oh, this something else, cancer may be playing around. Because when you get cancer, it will always continue to produce this, and each time they do it, the figure just they go. Okay. Now, how then they do the another way within the examine? One way you don't do to the doctor don't check you na the clinic. The other thing when you go na hospital, where they go do now. I mean, if you can see this picture, they can do a scan. The scan within they do, then they a very uncomfortable. But then they put this green thing, we'll see so, now a scan probe, when they pass through your back passage. And because the prostate gland and the bladder, they close to the back passage, you side the poo they come out. So then they prepare you before that, and then they introduce this probe inside your back passage so that it can close to the prostate gland, so that they will be able to see the prostate gland itself. So that's not the thing they can do. Then when they don't do that, the next thing when they do, then they take what they call biopsy. Now, this biopsy, all it means is they don't take this ultrasound scan, this jelly scan in column. They don't go through your back passage. They don't say, oh, this gland has something else that happen in certain areas. So the doctor now, they take a needle, a special type of needle, when they anesthetize you, and they go through for take some part of the prostate. Now, that part of the prostate where it take them for sending at the lab. Now, they can take up to 10 to 12 parts of the prostate, and they take can go to the lab. Because there's despite this scan, they show, they show all the area which I sometimes can miss in 45% of cases, can even miss the side which I real the cancer day. But in most cases, it's able for check that side, and they then can go to the lab and take part of the gland can go to the lab. They look inside the microscope. When you look inside the microscope, you see the way how the cancer, how the what we call our cells. Cell in medicine, like you get a building block, like you also the build. For where they build the host, they blocks them, where they put for build the host, nine and called cells. So not just like the whole host, feel like a human being. So the small block the way they put. Now then block, then if they change, the whole host they collapse. So now then block, then they call cells. Now then they go look for see if anything the changes they happen with them blocks, then they. Now, when they do this, when they don't take this sample and take and go to the lab, they don't watch at the microscope. Now, in addition to that again, then they check that and chemical where the gland they produce again for C with them. So when they don't put all this together, then they classify the person now based on how the chemical, the amount of chemical when the gland they produce, when they say the PSA, how high it is, plus how when they take the sample, can go at the lab, look at the microscope. I look inside the microscope. All them and then put them together before they begin, they classify the person now. Okay, and to say you're not low risk, you're not high risk, or not medium risk. Now, as I mentioned earlier, all them can and tell what they do so for take them samples there. So in some cases, then they can miss. So for make they're not able for miss then in there. It gets another specialist type of scan they can do, what they call the MRI scan, called the multi-parametric MRI scan. This na a specialist type of scan, na a magnet. It can very noisy inside. It can a very noisy inside, as I said earlier on. So, but in the able for look the whole gland and for see and even for guide the doctor say. Also, for take the sample in that particular area there. So let's just play a just small video of her. So we see waiting at the MRI scan.
This is an MRI scanner. This type of scan uses magnetism to build up a picture of the inside of your body to help your doctor either make a diagnosis and decide what treatment you need, or find out if your treatment is working. The radiographer makes sure you are lying in the correct position on the couch and explains what will happen. You need to lie as still as possible. MRI scans are very noisy, so you wear earplugs or headphones. During the scan, you won't feel anything. The space you lie in can feel small. If you think you will find it difficult being in a small space, contact the scanning department before your appointment. The radiographer controls the scan from a separate room, but they will be able to see and hear you throughout. Here you can see an example of an MRI scan. Once the scan is finished, you can go home.
Okay, so that's not just an overview of what an MRI scan is. And also, apart from the MRI scan, again, another scan what they do when they call the bone scan. Now, this bone scan, what they do basically, I will just check.
Hi, I'm Angie, and your doctor has ordered an MRI. And I'm here to show you exactly what the MRI machine looks like and what it does. What it does is a big camera that takes a picture of the inside of your body. How it works.
Okay, so this and as I said, that the MRI scan, they get the bone scan as well. When the bone scan can show basically if the cancer don't go at the bone, it is able for pick up area them at the bone where the radiographer and the doctor will see say, oh, this cancer don't spread na this side, na the bone, or na the lung, na the brain, and a different parts of the body. Now, after they don't do all this, then they now try for classify, we call and classify for put into partition. Say, well, we don't do the test with this chemical, the chemical or this gland they produce. We don't check this sample from the gland itself, the prostate. We don't check on at the microscope now, so it look like. We don't do the MRI scan. We don't check and see now, so it is. So based on this, we'll classify this person. Say, ion cancer, it just stay inside the gland, it not go any site. Now it's called localized. It not go no site, it just stay inside the gland. And the people who don't get that kind of cancer, they can live for years until they not going to get symptoms, they don't get no problem, they could live like any other normal person. So if you, to this night sign for sure, not afraid, go meet your doctor, explain to your doctor. If they will for find an early, then catch an early, then we will for help you, and you will live even much better life longer. No wait till when they say water pass Gary. Okay. The next one, now when they call locally advanced means the cancer now don't go outside. It don't go outside the close of the gland. Now they call locally advanced. The next one, now after it don't pass that stage there now, it don't go any sign of the all sign of the body don't spread. It don't go na the brain, it go na the heart, it go na the lungs, it go now your bladder, so you begin to get other problems. So now the stage now you say, well, maybe water don't pass Gary, and the treatment for that is different. Now for classified type, they talked just now before, say localized, now like this one, this blue thing what they see so, now in the cancer. The cancer no spread it inside the close. Now you can see this outside side, now in the close of the gland. It no go outside it. So somebody will get this, it can live for longer, and then can get treatment so they can do what we'll get for talk about later. And this middle side what they see, now the water pipe. Now when the gland in there, you need to press the water pipe, so you need to get no symptom. So if you no get symptom, no means say you no need for go see your doctor. I emphasize this again. Yeah. The next one, what they talk about, locally advanced, it don't go naya now. You see this blue thing, okay, see? It don't even touch the bladder. It don't go out of in close. It don't touch this outside the sperm can store. Now, this one are the testicle. The sperm they produce naya, it come up this tube, it can round, and it can store na this gland. This gland there, the medical info, and they call it seminal vesicle. Now, it is store, and also it come empty. And then this gland, the prostate now, as I say, it produce the water for let the sperm go be and go swim through for let it go form help for form the picking. So the cancer, the spread come there. But when it is still at this stage, it no go no site na the body. It just there yonder. Then they call locally advanced. The one now way na the advanced one now, I can see this picture, all them blue mark now they see. Now, it don't come on outside the normally supposed for the down here. It go na the bone. It don't go now. It don't go now up here. So they go na the liver. Okay. It go na the kidney. So all sides. So now making that at the initial stage where they talk, I say if you get back pain, in as much as you meet the doctor, back pain can be due to different causes. Information to the doctor back say you're concerned about prostate cancer, so it can do that test for you. So you see, it don't kind of the back naya. So it make somebody they get back pain. Now, what thing they can do now for determine how much, say how long you they live, or how much you be able to survive this cancer where the person don't get. This depend on which stage a day. Like I talked earlier on, all anything they don't put together, the doctor don't put together for say you know this stage a day. Like I don't talk earlier. And also the chemical, the PSA test, a result, how high it is. And based on that, then put you in a score. This the doctors then they know about this score. It's very common with prostate called the Gleason score. When I use for classify the person, say either you're not low risk person, or you risk the in between, or you very high. And then the treatment for each of them stages and they different. We will talk about them in the next few slides. Again, waiting and they look into, then they look into all them things and they only, then they look about your age. How old are you? Which other medical problems you get? Some man, apart from the prostate cancer, where they don't diagnose them, they get hypertension, they get diabetes, you get lung problems, COPD, you get asthma, all them things, then they come together for determine say which treatment for get this person here and what you prefer. Because in medicine in the UK, a more patient-based. The patient can for determine what he want. They go dictate, dictate to the person what's in this, or you get advice, but you get the right as your patient for say me na this me want doctor. Okay, so now when they don't do all of this, waiting the doctors and can do in the hospital, and they go get a meeting. This meeting they call on the MDT meeting, multidisciplinary meeting. Every day they happen at the hospital. So this meeting include one, the person, your personal doctor, include the surgeon, include the radiologist or the radiologist specialist, and the pathologist, the man where they go look inside the camera for say this cancer and so it don't look like. They can mention earlier on say the building block them of the host. Say so it don't turn. They all they come together, then put the picture, then put the person in history, then tell this person so he age, now so other medical problem don't get, then decide. So all then put all into your hospital doctor and decide now say, well, this man here based on this condition we get, we think say now this treatment you forget. Okay, so you talk say, so again, I say how far the cancer don't spread and all anything and your general health. Then they determine, and then again, how much which of this treatment they give, they all get side effects, then get things that will affect your life path, how much you will cope with them. Okay, so these are the things the way then will happen in the hospital where they go look for determine your own stage. Now, for you as an individual, what you go do for make a decision, say, okay, this they don't diagnose cancer, what me go do for I go for decide whether I would get any treatment or not. So this is not just a picture where and in the NHS they get this predict tool where they don't study with over a lot of people that will get cancer, prostate cancer, where you can do on your own. You don't need for me to doctor. The only thing you need then test, then waiting at the result of them test. Then all you can do you fill in the details in there. You put your age, say you know age, how old are you? 48 or 49 years, and this test to them, you do the PSA test, a very useful. You check how much na the figure of you put in figure like 12, okay, and then the stage where they don't put based on when they look at the microscope, like this, and then whether if you don't go to a hospital before, if you don't admit in the last 2 years in a hospital, then put on say yes or no, okay, and then whether the BRCA gene will be the talk about initially, if it did now in a family, if you say yes or no, you can put on, let's say the person here, get get BRCA gene in family, but they don't go look at the thing, they don't say you on cancer at this stage today, okay, and they don't do the score, they say that this you score na 8, okay, then figure then you may not know them, but your doctor or your GP need them figure, then they can ask them, you can ask them, now you write as a patient, for you details them. You can ask, you can go to the hospital, you say, well, I want me record. Then get right for you the record then day. So you can go, you put in all them value then day, and also whether they don't do biopsy or not. Now, when you don't fill in all them things, then they give you a figure. But now one catch by this test, by this tool here is anybody when cancer don't spread. You not at all. You see them put on if your cancer don't spread, you don't need for use this again. It means there is no way they can do any treatment for you. So this shows say the earlier you go, the earlier the person go then check, the better the treatment. If you don't pass to that last stage where they say don't go beyond stage, even use this tool in the work. So for let it work, if we say you want cancer not spread it, you not metastasize it, not so it is. Now, based on that, then they will show how much you will survive if they do nothing. When they say conservative treatment means they do nothing, then go just they monitor you. The chance for let you survive based on all them figures that we don't put Now, say 91% chance stay in the next 10 years, you will able to survive. 91 chance in the next 10 years, in 15 years, the chance for you survive maybe 79%. So as you change them figures, then up here, and so the figure also down here they change. Now, if you say you want to do treatment, the chance of only you to survive they increase, say 94%. After 10 years, 15 years, the chance they increase to 87%. So if they do them treatment, then so your chances go there. However, with this one, when they do treatment, it come with complications. So then complications, some of them, then complications they mention there, some say you know go before your manhood, no go before TNAP, some they go wet all the time, you know, before control your bladder, some thinking there you bowel back in for control, they go get diarrhea and constipation, all in things and they. So, but in a decision again, we get for make, you get for weigh the risk. Say, left this cancer, let go, let them no more like so then do nothing, or let them do something. Now a decision where you and your doctor can sit down and talk. So now the treatment. Now the first treatment is they can monitor, then do nothing. Okay, if not the early stage, they don't menu and then just they monitor you, they say, well, no, do nothing. And again, if they then decide for do treatment, this is not the type of treatment they do. Either they can do radiotherapy when X-ray radiation and then they put by you and the gland for destroy the cancer in the body. And also they can give some hormones them, treatment, medication, the way they suppress the hormone in the body. One of the most common hormone or chemical where one of the most common chemical where they help the cancer for grow, then color and testosterone. Then they give medication then for suppress that day. And so thinking they then say, well, do operation, so we pull the one whole thing. Okay, and again they can make the combination of them treatments then they. So then you can do what they call cryotherapy and also ultrasound type of therapy when you do high irradiation to the gland for let it will reduce them. But now then to their cryotherapy and ultrasound therapy, then only they do somebody we want for do studies. So if you go now hospital, they mention anything there, or they go to the doctor, they mention anything there, you get for ask waiting at the details of them. Because if you know one day into studies, they're not for put you into them. So you get right for saying, no, I don't want this and that treatment, and that treatment I want. Okay, now I try to classify them when they are into different stages. If your cancer no spread, no go no side, like I will not be don't see this picture before, this blue area, it no go no side, what they can do? And can decide, say, you and the doctor and I can decide, say, well, this cancer no go no side, it just there in the gland, it not go outside the close of the gland. So what you for do? Not just the monitor. Not just the monitor them. And now, how for go about monitoring this? Then they get for the check, the PSA test again, and they measure them. They get for the check them every 6 months or every year. Then every year, the doctor, they go back, he go examine, he go check you the gland through your back passage for see how it can look. Now, so then they do, and then every year, then they go back, then go take what we call biopsy, then we'll take some sample from that gland, check on at the lab for make sure say it not begin change it. The blocks not begin rotting it, the blocks not begin change it for brocdios. Okay, so they know say a fine force. So then they do that day until they notice say this why I think say the block they don't begin the boil, then they decide now say well we'll do that treatment. Okay, some people can through this sometimes for 15 years, they know they get no problem, and then no more than they happen with them. So again, this they show say no afraid for see doctor, no mean say if they diagnose cancer, mean say the person they die tomorrow, it can live for up to as long as possible, but it depends on the stage. Who are the people who are suitable for this kind of treatment? Now the people away, say later on if you want to do operation, yes, it will be for withstand the operation. You know, get the medical problems in Panama. Or in cancer, it just deny, spread it. Okay, and somebody with young cancer, it in between. They don't change and say this, it in between. But in just decide, say, I don't want no treatment. They say, okay, well, they monitor you because that's the you want. Now, the other type of treatment then they do, then call her watchful waiting. It's similar to that one we don't talk about before, they call active surveillance. It's similar. The only difference with this watchful waiting is that they're not for they take every year, go take you and take some sample from the gland for taken at the microscope. Now the main difference stand depending two. And the person where they go into this, the person you not get no symptom at all. And then the person again, where they go into this type, now person where they don't check and say this, if they get for the operation, maybe the operation will be too much for them. And again, if they say then they go do radiotherapy when na X-ray, then they put on the person, then they're not waiting and call. So basically, na then treatment and then they can do. The other one they can do, they can take the one gland off. Like this one, operation. I think this is not the most common way they can do in third world, in the developing world, like in Sierra Leone or other country there. Then they go take the one gland, then pull them. And when they pull them, that's so they think they turn now. And again, no gland panel again. Now, they can pull them, then they pull this outside the sperm can store. Now, if they do this one, so for somebody who want to get picking later on, they can even take them sperm, they need a store now na special lab. We can need it for 10 years, 15 years. If one for born picking, they can use them. So this now one, then if the cancer don't go far, it don't spread, they can do it in a called laparoscopic keyhole surgery. All in green tear, all this is so, they can pull them. Then the other two they can do now robotic surgery, like a robot. You know me saying a robot, but what it mean something like this. One unit there with the doctor, they sit down, then the other unit there with the patient, they deal with the anesthetist, where it can do the operation in that kind of way. Yeah. Now, if the cancer don't spread, it don't go far, it don't go out of the clothes. The other thing they can do radiotherapy and hormone, as I mentioned. They can also pull the cancer with the operation, or they can get hormones them if they want. And they can do it in a called brachytherapy. Within brachytherapy, like this one, and they put small seed there near the cancer, so that then this seed na seed they would then produce X-ray them, like radiotherapy, where they destroy the cancer inside you without they not put the cancer out and the X-ray outside your body. If the cancer don't spread now, is an advanced treatment. It don't go now the bone, it don't go all side. In that case, they only can say water don't pass Gary, no other operation they not can do. The thing they can do now, then will they give you hormone treatment. The hormone treatment and they like for reduce that hormone where the man gets, the chemical where the man go they get testosterone. Then they reduce them. And they reduce them again for get and then medication there. So then an injection. And the injection in the beginning like Zoladex, now one of them. How in the work, it stop the message they come up from the brain for come to the testicle for produce that testosterone. Then also in the work, and they can get other tablets them where they suppress the testicle not for producing anything in there for that hormone they or they do operation for take the testicle away. And at times they can get a steroid. Or again, they can do radiotherapy. So in this stage now, at that stage, we know one most people they could they do them program there, that people then go aware and see the doctor as early as possible. And when they don't do the cancer now, you don't get time. How you go live with the cancer? One, we will not say this is not thing where people then get for when one first they don't say you person get cancer. They make some money they numb, some money they confuse. So man, it a vexed force. Even possibly near the vexed force. And so my just they feel guilty. Na me problem, na me fault. All them thing there, the person they get through in mind. So na day you need support. The family around you, the friends around you, they need for aware. Not keep on to yourself. If they know, think that this they go through this person, if you they vex, you they angry, you just stay to yourself, then go for know how for come to you for help you. Okay, and at times if you go see your doctor, if you're not able to remember all the things, then you can write them down on paper. You ask the questions, or you get Bɔdi, somebody where you trust. It can be your family, it can be not to your family. And go with you for see the doctor for support you for ask some of them questions and they. And the other thing again, you talk to people them. Not keep everything to yourself, not bottle things and talk to people them. You go able to get the right information, we go help you. And then be positive. Try for exercise. And do a well-balanced diet, and you try for relax because anxiety itself, sometimes somebody they get prostate cancer, the cancer itself may kill but not different in the engats, they end up cause them for losing life. So you need to get support, the support again from your family, friends. You know, then you meet your doctors. On Monday, get spiritual leader then. When they go meet the imam or the pastor, or, you know, meet them people and they can help you again, you know, for make you feel, you know, able for cope with things. Governments get different benefits than they give. If you know the work, you get the ESA, employment support allowance. If you not ask, you know, go no. You know, get charity grants the way they can give. You know, and Cancer Research UK, they get number, you know, this number I put down here, where if you call them, they can even give you advice on things that we will forget. And as I said, complication then they get so much. So on these notes, I try for summarize the people and say, let we not suffer in silence. Let we talk about this thing where they happen. Because if it's too much quiet about her, then you will suffer in silence. So we can get questions now, and thanks everyone.
Thank you very much, Dr. Ture. I hope see me fambulem, you know, on all don't learn something new today. Because I remember I hear this for the first time. I be talk and say I don't learn a lot, but I will talk as well. Say by the time we get this show today, there's a lot more we learn. They are the big. If anybody there on the background way noisy, Mr. Pratt, yes sir.
Yes,
you want to ask questions, sir? Go ahead,
yes, sir.
Yes, sir.
Yeah, I mean, I'm one of the people who they suffer from this BHP. I mean, they take the drugs tamsulosin and finasteride, and at the beginning, it may reduce the prostate because when they do a scan, it was around 700 cc. Then they reduced to 70 cc. That was from December last year. But now I find out that the drug don't get the prostate don't increase back to 655 cc, which means instead of the reduce arm, you don't get a repulsive effect. Then they suffer a lot of focal and side effects, constipation, muscle cramp from the chest, right down to my back, my spinal cord, my foot all the wither, or they give way. Then if I get for urinate or use the toilet, I can get for push a lot, only a small pencil like something will come out. So I don't know what thing you advise.
Okay, so in that case, there is still the benign prostatic hypertrophy. It means that the gland is still big.
Manchester. Yes, sir.
You know, reach the cancer stages. However, this not still a sign of you getting for let them check it further for make sure
yes,
they exclude this prostate cancer. Now, their medication, the way they take tamsulosin and finasteride. The tamsulosin already they do the gland is in a muscle. It relax the muscle and makes the way you want for pee, the pee they come easily. Now the finasteride already they do in really good, it help for shrink the size. But as you say, if they shrink them, but now it don't get a rebound effect.
Yes, sir.
They might need to, see with your doctor. They might need to increase the dose, or they may change them to a different type of medication. But in the nutshell, let them go, then check the PSA, especially you don't get some problems, you don't get back pain, you don't get some other issues that they happen, let them go check. If they check the PSA once, it might be a high. Let's say then check the PSA is 5, which is pretty high, okay? 3 for somebody 50, about high. So if they check and then get for repeater again, say they repeater in another 4 weeks. If they continue to go up and up and up, then a sign say they need for send you to a hospital for let them go check further. They can do this multi-parametric test scan. Then go for go do the biopsy. Then could say yes, fine, but ask them for that scan first. If they can do the scan first, because it guide them as to where they go check to take the biopsy.
Okay, sir. Thank you,
So
sir.
the answer your question. Dr. Kamal, you get anything we are add, sir?
Yeah, Mr. Pratt, you there under the urologist or not?
Yes, I do under urologist, Dr. Ture, na Holy Spirit Masuba Hospital, na McKinney, and I mean go see Dr. TB Kamara. But now Dr. Ture na Masub Hospital don't refer me to Dr. S.S. Dumbuya at Connaught Hospital. So I foresee him during this coming week.
Right. I think my colleague Dr. Ture Naya, they probably think say not to fit on you there. I don't know.
That fit on that day.
Exactly. I think say the anything that we tell you so that's kind of way they mentioned. So now for we Naya, not to for Naya dynamic.
Okay.
So I don't know if I get that in that future.
I they read online so much about this prostate because I know say I'm worried, but I don't really know. So now I make anything concerning prostate, I didn't get in touch.
Clearly.
So now I make Agladi from one of the way Manchester adjacent team, I go advise something way I go do.
No, as I say, not a bad thing for waiting Dr. Ture the advice, but if you don't the urologist, perhaps if they're able to provide the kind of investigative studies where we suggest to use it like that camera, that ultrasound, and they put on the back passage and all that. So they're not available in Africa, but certain places like Ghana, Nigeria, or even India, go get them. So if the urologist is able for maybe refer you to them and you're able to afford that would be a good thing for do. Now, again, if they're able to do another scan, maybe the MR scan or maybe the CT scan, probably then they say go for help you for establish whether this thing still in that area anyway, not just a benign prostatic hypertrophy, that BPH where they talk about, or you don't go further beyond that inside. From inside, you don't go outside, and especially the talker now say where you want for go for pass water, you get for strain, and even when you strain, and just a small drop will come out. Now these are all the sign that they explain to me. So now I sign them for sure. Say probably things that they get on top of you. As a result of that, the suggestion that the urologist is definitely not the best person for sort this out and decide for see whether he need for seek further advice from your other colleagues. Them, I should say they must get that network the way they go for help you one way or the other. But we hope say this will end up in a nice way for you.
Okay, sir. Read about a treatment when something hits and they pass hot water in the form of heat through the penis and where they dissolve the internal lining of the prostate gland. I don't even do in the Africa region.
I can talk to you.
I will let Doc talk about that.
I can talk about that if I'm giving the floor, if by chance.
Yes, Doc. Yes. Well, good to see you, Mr. Abu.
Thank you.
Welcome on board.
Thank you very much, Doc. And thank you very much, guys, at Manchester for the program. Doc, nice to see you again. And Dr. Ture for the presentation. Just for a quick background, I get special interest in prostate. I was a specialist nurse in prostate care at the University College London Hospitals. I started prostate assessment clinic. I'm now a lecturer at London South Bank University. I don't make few publications on prostate cancer, prostate. On the spot, with most of the things that we don't mention, if I can go back to broader back home, in prostate, I think it move in the direction of surgery for your prostate because the finasteride, the maximum dose is 5 milligrams. You cannot give anything more than that. The tamsulosin, like Dr. Ture said, they just relax the water pipe a little bit. It doesn't help you very much. If you have an enlarged prostate, then it likely they then get for do some surgery for just increase the channel, and it's not dangerous. It's most urologists are very it's something what they do. So it's something for you can think about. The other advantage of doing the operation for open your water pipe, they can able get some tissue. Then they can check that tissue and see if anything there of concern. Okay, your prostate size where you get a possible say it produce PSA where it not necessarily means a cancer related. Because the bigger the prostate, like Dr. Ture said, if you get a prostate size the size of a tennis ball, which may be about 150 cc, you can produce PSA of up to 20 without get any connection to do prostate cancer at all. Because the bigger your prostate, in most cases, the more PSA, that's the prostate specific antigen Dr. Ture will talk about, they produce. Of course, like he said, they're not very reliable, but still most clinicians to use.
Okay.
That's to do with the size of the prostate. So if you get big prostate, it will produce more PSA. Most of the symptoms Dr. Toure went through, which is absolutely again, very on the spot, they can cause you concern when you go to your GP for at least starts the ball rolling.
Okay,
But
sir.
don't forget, and this is for everybody else listening, and not necessarily that the cancer is there. The later stages of the back pain, later stage where the development takes place. They unfortunately back home, and even here in the UK, not a lot of people get access to the multi-parametric MRI scan. Now, very few hospitals in the UK gets that. And my contribution to this conversation is that the transrectal ultrasound biopsy, it'll go out of fashion a little bit now. And research, increasing research is showing that. Because by most places to do, of course, because it used to be the gold standard. But now what's coming in is that when you go, if you can't get to a department to do the multiparametric MRI, it'll give a good picture of the prostate. And then from that, they can able to give you areas of concern. They can able to use the information to do special kind of biopsies, and that can even include the transrectal ultrasound biopsy. The problem with the transrectal ultrasound biopsy, you're not able to get cancer where it to the front part of the prostate. And the cancer in the front part of the prostate usually is very aggressive, called the anterior part of the prostate. But if you don't do a multiparametric MRI, it can able to give that picture, and based on that, they can able to do, they call it template biopsy here, or targeted biopsy, or they can even do a transrectal, but targets the area that they are looking at. We not get the facilities back home. Forget about it. Yes. What we get is what they give you. And maybe they move to the direction. I think Dr. Toure mentioned, plan they talk about benign prostate hyperplasia at some stage, which is where you are at the moment. And I think you're moving the line of likely surgery, where they could just open your water pipe a bit. That much I can say at this stage. Thank you.
Thank you, sir.
Thank you very much, Mr. Abu. Thank you very much. That was a very good contribution. Mr. Pratt, I hope the advice with three professionals they don't give you, I hope that they go help. And yes, if you know them people also as well individually, like what I've been saying at the beginning of the show, I don't know if you've been there. If you're able to ask questions, fine. Not all man can able be, bold enough to ask questions. But if you feel you ask something way very personal, this they go out for everybody. Please feel free for get in touch with one of the medical professionals there and will give you advice. And the advice when they give you will remain private.
How can I get their contact line?
Okay, I will type with email at the bottom, and if you email you ask that, you say your question which you want to ask, we will discuss it within the team, and somebody within the team will be in touch with you. If you put your email, and also if you want them to talk to you by phone, put your phone number, then one part of the team will get in touch with you. Now, something they will give you in writing and will give you advice in writing. But like what they say no more at the beginning as well, and waiting Dr. Toure say when he starts, we're not there for replace people, the medical and consultants and stuff. No, we still advise you if you get problem, go hospital. Only what we ask for now for giving an overview, advice for see how we will look after ourselves. That if you begin see certain thing or you begin feel a certain way, I need to go see my doctor. And also we think they explain to an hospital, we try for break and down also to a standard where we all will able understand, because some of who go hospital, we doctor don't open mouth, don't tell all them big word here.
Don't get frightened.
They become confused. And something about depending on which they don't go tell you, Dr. Toure stress on that, depending on which they don't go tell you. half of the stuff where the doctor they tell you now you didn't understand again because you didn't work normal now for how maybe I can't die or maybe how this thing get for affect me, maybe they remember how it get for affect your relationship, maybe they remember how it get for affect your earning, maybe get for remember how it get for affect your normal everyday life. So man they go remember now say maybe my mama papa business I don't so for me. So all that anxiety they go they build up. So it bet I make them show you so better for like we break things down and explain things to you.
Okay, thank you so much.
If anybody else get it, thank you very much, sir. I will share the email in a bit. It will be on the chat. And whosoever give you the link for let you join the show, you can reach out to that person there as well. We will share the email, and I will make sure say going forward as well. I will continue for include the email address on the flyer. Normally I can do them, but it depends on the type of design where I do something. The space not can be big enough for like Adam. But I will try for make sure say they squeeze with emails them on the flyers them. Thank you very much.
Thank you. Thank you too. Thank you all.
If anybody, sorry, sir. I'm trying to unmute yourself. Sorry, I mute you. You be there about something. Yeah, go on, sir.
I just want to thank all the other doctors for their input. I really impressed.
Thank you very much, sir.
Okay.
And also with the appeal to everybody within here, we don't know the background of everybody there. But if anybody gets influence for we get this show onto the mainstream radio station as alone, please do when I get in touch. We will try for see how we able to get this to people and because we believe say not only normal within also will benefit. A lot of people and they will go benefit from this if we able to get some radio program as alone.
I don't do a recording. We can pass on to the radio station. Actually, talk so they do recording.
Yeah, no. If you want the recording, just get in touch. I will give you. There's a recording way because at the moment as we do, I'm with the record. So if you want the record, just let know I will give you because until they are available for everybody. This what they do. The way everybody say nobody in the house know they get paid. We don't know they get paid individually for this. We all get professional jobs that what we do. We only do this for we self give back to the people them. Them people are, everybody don't learn in book, don't go through your own struggles in life. But we look and see a lot of people and they really suffer needlessly. Sometimes some of the things they will suffer from, nothing that we don't need for. So that make they do this. So if you want the recording, we will give you, and also all the other sessions that we don't do before, in the past, they're all there on YouTube, and then they're on Facebook. Hopefully by the next session we'll even get Facebook Live. I've been trying for doing today. I face a little bit of glitch, so I make cannot do one. But by God power, by the next session we will be in 2 weeks. We'll do on Facebook Live. Okay.
Okay. Yeah.
All right. Anybody else they want to ask question? Okay. Dr. Ture, what I want to ask is, waiting at the thing the way people will do, maybe lifestyle changes and stuff like that, we will reduce the prospect of not face this problem in the future.
So the first thing is awareness. Okay, aware say this they exist, and aware say there is a treatment for it, and earlier you then catch them, the better it is, like Mr. Pratt, he be very bold in things and he on the treatment, which is good. The other thing you can do, not forget a healthy, balanced diet. Healthy, balanced diet, you exercise regularly and try to maintain an ideal weight. And the ideal weight basically, can be a BMI. We normally check the height and weight of the person. If you're between 25, between 20 to 25, that's, could be fine. Okay, if you say you weight too much, you got to do exercises and try to get a really good balanced diet. You see, and if you say it did on a family, somebody did on a family will get cancer, you get for make sure that you see your doctor early. If you're not with one of black people under the age of 45, see your doctor. If you get them symptoms all over, we don't mention before, you can see your doctor. Then they go help in a way.
Okay, thank you very much, sir, for the advice. Anybody else within the team who want to contribute? We get another, say about 9 minutes. Yes, Sisiwugi? Yeah, I don't unmute you. There you go. Yes, ma'am.
Yeah, thank you, Dr. Ture, for the information. Yeah. The question about for us, I know for say chemotherapy not in I don't know if then they do in Africa, but where then they do the chemotherapy now waiting now the purpose of that treatment day.
Okay, so basically the chemotherapy they try for let you know make the cancer spread, go far downside there. So like you they stop and say, okay, now you don't reach, you for stay at this line here, let you go beyond this line here. Okay, and in some cases when you do the chemotherapy, it maybe try some of them go try for like destroy the cancer cells again. But in the process of doing that, it will destroy the normal cells, like what they talk the building block. The osing block, you get some sign at the os way down, they get all the way down the rotting. But the way one go make them, the one we didn't around the way good, it destroy them back. So nadan in the thing, but and the main essence for stop a lane no go far than usai, every day. Like just day so normal, then you go able for live come good life. Again, it get side effect, but some people everybody different.
Okay, thank you.
Thank you very much, Mr. Abu, Mr. Victor Abu.
Yes, my contribution coming back is on the minimally invasive treatments where Dr. Toure mentioned one or two. The what they call microwave treatment when a high intensity focused ultrasound. And then another one is cryotherapy, when I like freezing therapy. Like Dr. Toure rightly said, at the moment, not a mainstream treatments then for prostate cancer, but increasingly money they get attracted to because the results are getting better in the clinical trials, what they do. So if I can just mention a little bit about that, what they do, and it's worth considering it if you get certain type of prostate cancer. Like Dr. Toure said, if you're in a low risk category, it's a lower Gleason score, then your cancer not spread all over your prostate, not outside your prostate, I talk about inside your prostate, and you anxious about the cancer, then you can consider this developing treatments. Once they do the ultrasound treatment, then they identify which side the cancer day, they identify which of the cancer are the worrisome cancer. Then that one in the end they treat, then they microwave them. It's a day treatment. They go in maybe an hour and a half to 3 hours, and depending on the length of the treatment, you are out of hospital. What's the advantage, if I have to say, that they treat the whole prostate, they just treat the area who's at the cancer day, and therefore they reduce your risk of the high risk prostate cancer, of course. Then they also reduce the side effects the way they get from radical treatments such as surgery and radiotherapy. Like Dr. Toure said, if you get surgery or radiotherapy, it gets symptoms of your water works for past water, they get difficulty time with the leak small, or you lost your manhood, your erections, or you're not able to conceive again if you know sperm bank. So what's in this minimally invasive treatment like the ultrasound they do is it treats the cancer way they worry about, they minimize the symptoms. Similarly to cryotherapy in a freezing approach that they use. So what Inigo suggests, if anybody get concerned, they don't diagnose, not to worry too much, ask questions around and see which areas then they will give you good diagnosis, test them, and which areas then they around the country, because now I think I stand to be corrected. You can tell your GP say, go one for go to that hospital for them go do me treatment. If you think say, now day you go get a good service, then you'll be able to do the test them and you'll be able to do the treatments then way available. But the minimally invasive treatments then they're out there as well, where people can consider.
Okay, thank you very much. Because the area we touched on, somebody just asked me about side effects and stuff. So I hope Danny don't answer that question there as well. Are there any other side effects the way people need for, be mindful of, Dr. Toure?
Yeah, I mean, if the cancer don't spread that far, it don't involve your bowels, so you will get things like constipation, things like diarrhea. And again, if they get the medications within the GI, some of the hormone treatments that within the GI can cause, because they try to reduce the testosterone. So they cause people and they get symptoms like man will get symptoms like woman will get menopause, they call it andropause. So they get them symptoms, and although medications then they within the GI again for counteract the thing and they. You see, so and with the extensive, treatment they're willing to do radiotherapy from external side, the radiation they come through for destroy the prostate, cancer cells. They go through other structures then. So the tendency for then structures and the wall of them structure begin changed for form cancer again, become high basically. So that make them tend for being locally, invasive things and what they can do, like Dr. Abuse, Mr. Abuse. If you do then things and it will reduce the chance of other structures around for help. But before them put a particular studies out there, a treatment out there, say everybody for doing, they need to do extensive studies, which is why things like, cryotherapy and then high radiofrequency test the way they talk. So then but mainly in some areas, they localize and say this not for studies, clinical trial, basically, because you don't get 100% proven benefits, although studies they show yes, it may be beneficial.
Okay, thank you very much, sir. Yeah, one question I want to ask. Now, we can see the small flyer. Yeah, we can go around now. WhatsApp and social media for say certain remedies that can help. What you get for say about that?
Well,
someone will say turmeric and whatever else, thinking tomato or whatever else.
Yeah. I mean, things and the way people and they study actually, but I mean, like when we talk in any kind of program, that we only try to do what they call evidence-based medicine, thing where they don't really do studies and find out say this they prove, because when you talk, it's for the whole public. Other when they say tomato, if you get and tomato basically it gets a chemical called lycopene, where if they more when you cook them. And some people, if you get them, they reduce the way they progress, the cancer they progress. And pomegranate now other one backward and say some people where they don't study people who get cancer, then you take them and find out that the own cancer not progress that far. It just stay static as it is, or even some they even shrink the cancer. So and then some people will say green tea, based on say, Asian people they like more green tea, and so maybe get some good components in it. So all the things in there, yes, people and they say they're out, but 100% proven to be beneficial. 1 or 2 studies will show say yes, they say fine. See, so when they put off person say not take them, but the take home message here is get a healthy, balanced diet. That now they take home message for everybody, and do exercise regularly and be aware that this thing is happening, not to a death threat. If you see your doctor, you can be treated.
Thank you very much, sir. I get one more question. Somebody say, any hope of using gene therapy in the future to destroy tumor cells? Is there, you get anything for saying that?
Yeah, there's studies and they're around for show them thing and they, but it not proven. So where it not proven, say yes, people in this as I said earlier on, even the prostate cancer, we don't know the cause. So all sort of treatment they come up, new treatment they come up for help people and basically for live as long as possible and control and get over the cancer as much as possible. So yes, there is a prospect of all and things and they happening in future. Yeah.
Thank you very much, sir. I know, say I've been promised one very good question, but I will let him now because the question I will ask. We don't run out of time. If I'm with them, I thank you.
Why not, Mr. If it's relevant,
well, I go ask. Basically, there is certain myth maybe we don't go around social media what we don't see before. We say regular mama papa business, it reduce the prospect for get this sickness. Waiting on a take on regular one go reduce them or less go reduce them. Waiting on I say.
Well, regular it all intended prove yes, not a myth, but people then they talk say, well, the prostate gland itself not a muscle. You know, when you they get sex, it is help they squeeze for secrets and produce some of the chemicals in there. And so the more you get sex, the more it left for release, head for release, then thing and they again people and they mention all them things and they, but as I say, it's not 100% proven, but people and they would face it when and get studies say yes, it better it beneficial in that way. And I think one study reads say if you want forbidden, then you never forget what they call ejaculation 21 times a week, a month rather. For like 33%. So all the things and then so it depends how yeah, maybe other people then go throw light into as well.
Yeah, Dr. Kamara, I can't say Mr. Abu. Just Dr. Kamara.
Yeah.
What do you guys want to say about this?
I mean, well, as we're talking about, you see, because we go Western school, it's very difficult for me for Timapia and tell you say, nah, so naive, they say, because clearly this not that you get any scientific evidence for backup. However, then they tell you say the prostate, they encourage people for empty at least once every fortnight. So
fortnight, and a long go. I would say say every 2 days.
Well, you see, that's the problem with it. Like you say, because if you empty, obviously, you have for as doctors say, you have for the muscle, and of course the express, like anything else, like a store, you need for replenish the reserves and things like that, and that obviously help towards reducing the possibility of that particular either enlargement or maybe any kind abnormal cells form pattern. But as I say, it's a bit like somebody tell me, say, my grandpa don't smoke for 40, 50 years. Yeah? The time where he left for smoke no more, that they tell you get lung cancer. You tell me? What you will find out is that not just the smoking. Of course, the cigarette when nicotine get, the carcinogens and things like that. However, there are a lot more factors which can lead to that. So if we say not just the fact say where you actually do mama and papa business, boku time, that means say the prostate no go get big or no go get unwell. Well, tell me how the chief then we get 90 well. How did they get that?
Oh, okay, we'll answer that question.
All right, so that's the thing, Mr. K asked the question, right? As I say, so there's nothing there, you know what I mean? So,
yeah,
if you ever get a balanced diet, and obviously check that gene very important, because if you get in the family, that BRCA gene, absolutely vital. If you get that, then clearly you could begin make, ways and means, make steps towards getting that sorted out. But for me, as I said, the important thing is, remember, say, when you begin to feel the symptoms, even if you don't feel them, if you get to the age of 40, 50, you begin to say, man, when they go to this place, the stream not as good as it been there. You know what I mean? I got to begin pinning, I got to begin think about this and that and that. So until I go begin dribble small, well, clearly. And of course, if you get in the family, you get a first degree relative, either papa, grandpa, get them, please, and pretty please, get yourself checked out. Mean say when you get checked out, that means that, but it's good for you, because if you begin and then catch them early, the chances of success far higher than when you wait till late, and then by then you don't get much for gain from that.
Thank you very much, Doc. Mr. Abu, I'll go, because of time, dear Abig, I will restrict you answer to just 1 minute, maybe, please.
Do I have anything to add to what you don't say already? Thank you.
Okay, that's fine. Dr. Toure, I will say, well, you go use that 1 minute today for give people one last line or whatever they need for take home for letting them, for letting go member for do.
Okay, so many people learn prostate cancer are real, and having a prostate cancer no means say you're at the end of your life. Treatments they available, and the more you're aware, you know about her, and you meet your doctor and explain to her about your symptoms, you then find out early, the better the chance for you. And also for the people that we already, maybe apart from prostate cancer, BPH, then get and then family, the wife or the partner, they need for aware, say, the husband get this condition, not to fault, and need for be very much supportive. Because this is not the reason we make some man they not even want to talk about the thing. because they fear about how it will affect in sex life, how it will affect in relationship. So the woman for be on board with the man and know, say, yes, this is what happening. Let it not be in alone. So,
much,
I think so that will be useful for everybody for now.
Thank you very much, sir. Me famble them on all. Thank you, Dr. Ture. Thank you very much, Mr. Abu and Dr. Kamara and the rest of the panel on all. Thank you. Me famble them from whosoever on our tuning today. We tell on thank you. We appreciate on all. We hope say this message you don't give us today. It don't change somebody in life. And look at this, all the recorded and day on YouTube and we'll put them on Facebook. By God power, the next show we will be in 2 weeks. We'll be able to record them. We hope say the next show will be on nutrition, menopause nutrition, but we'll confirm that day when the flyer come out. Till we meet again on our all. Thank you. God bless. Good night.
Thank you so much. Say a special thank you to Mr. Abu.
Okay.
Thank you.
It's probably likely say we'll take him up